Thioridazine, brand name Mellaril, is a typical antipsychotic that works by blocking dopamine receptors in the brain. It was first approved by the FDA in the 1950s and is used to treat symptoms of schizophrenia, including hallucinations, delusions, and disordered thinking. The starting dose of thioridazine is usually 50 to 100 mg taken 3 times a day, with the maximum dose being 800 mg per day. However, the maximum recommended dose may vary based on individual patient factors and the specific condition being treated. The recommended laboratory test before starting thioridazine include complete blood count, CBC, liver function tests, LFTs, kidney function tests, KFTs, fasting glucose, A1C, lipid profile, electrolyte levels, and thyroid function tests, TFTs. It is also recommended to monitor for changes in weight and blood pressure. It is also important to review the patient's medical history, including any pre-existing conditions and any current medications they are taking. Like all antipsychotic medications, thioridazine may cause side effects including dry mouth, constipation, blurred vision, drowsiness, and weight gain. It can also cause more serious side effects such as tardive dyskinesia, which is a type of movement disorder that can be permanent. Additionally, thioridazine can cause heart-related side effects, such as QT prolongation, which can lead to a potentially fatal heart arrhythmia. Thioridazine should not be used in patients with certain medical conditions such as heart disease, liver problems, or a history of seizure. It is also contraindicated in women who are pregnant or breastfeeding, as it can harm the developing fetus or infant. Furthermore, the United States Food and Drug Administration has issued a black box warning for thioridazine due to the risk of sudden death and QT prolongation. As a result, it should be used with caution, especially in elderly patients and those with a history of heart disease. There is also a warning issued by the FDA regarding the risk of mortality in elderly patients with dementia-related psychosis who are treated with antipsychotics. The warning states that these drugs have been associated with an increased risk of death in elderly patients with dementia-related psychosis compared to those who do not take the drugs. It is important for patients and healthcare providers to be aware of this warning and weigh the potential benefits and risks of treatment before starting or continuing therapy with thioridazine.